This is Curious Incident, a podcast for special needs families and your window into the world of special education. Special needs parenting can be challenging, and we want to make it easier by providing you with the resources you need to help your child. Let's delve deep into the world of learning differently with your host, special education attorney Adam Dayan.
I'm pleased to present my next guest on the Curious Incident podcast, Jessica Salonus. I've known Jessica for the last 10 years through our mutual affiliation with the Council of Parent Attorneys and Advocates. She is a powerhouse attorney and an amazing mom. Jessica is a special education attorney serving clients throughout the state of Tennessee. She uses her personal understanding of what it means to be a parent of a child with a disability to assist families to secure the services and accommodations their children with disabilities rightfully deserve. She seeks compensation for physical and emotional injuries caused to a child as a result of abuse or illegal actions taken against the child by school officials. Jessica also litigates cases involving retaliation against parents or teachers who advocate for the rights of children with disabilities. Jessica, thank you for being here with us today.
Absolutely. My pleasure.
So let's get started with some basics. Tell us a little bit about yourself.
Oh, sum that up in like 3 words. Wife, mom, lawyer. It's pretty much what I juggle on the daily is just trying to be there for my family and supporting my child, and also supporting children with disabilities. I'm sorry. It's a real passion of mine, and I love doing it. So that, in addition to being an avid LSU football fan and Titans, though we are currently terrible this season, love some golf and some lake time with my family. That's kind of me in a nutshell.
So you're in Tennessee now, but you were in Louisiana previously.
I was in Louisiana for school. Go Tigers.
Okay.
Yeah. But my husband's whole family's from Baton Rouge. He was born there, and so we go back a lot, see our friends, see our family. It's great.
Nice.
Yeah.
So we're here to discuss your experience as a parent of a child with cerebral palsy. Can you help us understand what cerebral palsy is?
Sure. It's crazy how you don't have much of a working knowledge of something until it personally affects you. And cerebral palsy was one of those things for me. I just had no idea what it was, or how it affected children, and how many children it affected, and adults alike. It's kind of weird. I look back now, and I was in high school with a kid who undoubtedly, now that I know, had cerebral palsy, but we didn't even know what to call it. And you never ask somebody, what do you have? Because that's rude. And so I didn't understand kind of what he was grasping with until my own child. But it's just a disorder of the movement and muscle tone. It's affected. It changes by where the brain damage is located, and the brain damage being from a loss of oxygen, and that's typically in utero or during birth. And so it affects. It's one of the most prevalent disorders, but it's a varying range of severity based on how much damage was done, and where the damage was done in the brain, and how it affects the limbs, the muscles, the movements, the speaking, the cognitive ability, all of it.
So that's a good segue. You mentioned that there's varying degrees of severity. Talk about the different degrees of severity with cerebral palsy.
Absolutely. It's helpful because a lot of people understand autism, right? We see that a lot more in our society, and understand the severity of autism, ranging from, the kids that are, socially more impacted to where they're nonverbal, right? It's a huge range with autism. Well, it's the same thing with cerebral palsy. It's a huge range. If you were to look at my son right now, if just sitting in a chair, you would have no idea he had cerebral palsy, but you would notice when he got up to walk. His gait is impacted, his speech is impacted. But that's how it varies based on the degree of damage to the brain. And you don't know what that is until, and sometimes they can't totally tell you, but they can look with MRIs and see where the damage is located. They can see and kind of give you a clinical understanding of what it's going to look like or how it's going to impact, but no one can really tell you for sure until you just get there, right? So that was one of the hardest things with getting his diagnosis, was They said he may never walk, he may never talk. I mean, you just don't know. And so you hate wanting to fast forward, but you're like, how bad is this going to be for him? And how is this going to affect his life? But to that point is, it is a varying degree. And oftentimes the diagnosis and what the child ends up, ultimately becoming or achieving is two very different things. And it's just very dependent on the right interventions and stuff. But there are 5 types of cerebral palsy. And it's a little technical, but I think it's helpful to understand. The first being spastic. That's also referred to as hypertonia. Hyper meaning tight, high muscle tone and jerky movements. They call it like the teddy bear syndrome. If you've ever seen children or adults that have their arm kind of at a 90 degree and it's really, really rigid, that's more of your spastic type. And that's the most common. About 75% of individuals with cerebral palsy are the tight spastic type. And that's where you'll see the jerky movements, rigidity. I don't know how to quite say that word. But that's where they're fighting their own tone issues, right? The other type is athetoid, also called dyskinetic. That's a combination. It's of hypotonia, which is, as opposed to hypo is low muscle movements, and then the hypertonia, the stiff muscles. That's caused by damage to the basal ganglia in your, and oftentimes they call it a disorganization. So that's what my son actually has. It only affects about 3% of individuals with CP, but it makes it very, very hard to treat because those children like mine are a moving target. His trunk is looser, but his ankles are very tight. His hands are a little tight. Neck is loose. So you're trying to treat 2 very different types of tone issues. So it becomes very complicated, particularly as they grow and change. But that's only at about 3%. So it's really funny whenever we go to Vanderbilt, they always get the fellows, the teaching kids, and they're like, you haven't seen this one. He's got dystonia. He's both, because they see so much of it's just rare. The spastic, right? So they get real excited to see him and to feel how that tone shifts throughout his body. The other type is called ataxic, and that's caused by damage to the cerebellum. It causes issues with just balance, coordination, voluntary movements. That's really the most rare. It's about 2% of individuals with cerebral palsy, but that's just where there's going to be more tripping. I represented a little girl with this actually, 12 years ago or so, 10 years ago, 10. And it was very, very hard to convince the school that she needed assistance because they referred to her as a girl that trips and falls a lot. I'm like, well, she has cerebral palsy. They're like, but they only think of, which is like a lot of people with autism, they only think of the nonverbal. They only think of the very, very spastic. And so we were trying to explain, no, she can't hold her, she was so unbalanced, she couldn't hold a pencil very well. She needed the therapies. So that's the third type. And then the fourth type is hypotonic, also referred to as atotonic. That's low muscle tone caused by loss of strength. So that's floppy muscles. That's part of what my child is. It's the ones that are, have less control. And so you'll see very weakened cores, weakened necks, a lot of times a droopy neck. It's basically flopped out is kind of how they refer to it. I'm trying to give you a visual over here. I don't know if you can see that, but
is that different from what you described before about loose muscles?
No, it's the same, but this is the other end of it. So you've got the hypertonia, which is the spastic type, the very tight, and then you have the hypotonia, which is very loose. And then, like I said, my child is both, which makes it extremely difficult to treat because medications to loosen, you'll lose. You can't just tell it. It's not like Advil goes to the headache, right? Like it's not like that. And so it's very difficult to treat. And I'll talk about that in a little bit, how they targeted injections and things. And then you've got mixed type, and that's caused where the brain is damaged in more than one location. So this is more of a severe impact. And that results in multiple types of CP. You see that in about 16% of cases. So that's where in utero, a child has suffered multiple types of brain damage, generally. Mm-hmm. But if that kind of gives you an kind of overarching backdrop of what this looks like, it's not one size fits all by any means, and every child is different, but they kind of put you in one of these 5 categories.
Definitely. That's a really good framework, and it's obvious how complicated it is.
Well, it affects your treatment, which type you have, because it affects how you're treating the muscle types, and which treatments are best.
Absolutely. And we'll talk more about treatment soon. So when was your son diagnosed with CP, and to what degree is he affected? I know you talked about this a little bit.
A little bit, yeah. So let me just give you kind of a backstory. So because I feel like this is important now that I'm on the other side of it. My son, I was induced and ended up in a C-section after a very long day and a half of labor. I didn't know. He was my first child, and I went in there with no expectations. I thought, I'm a lawyer, I'm not a doctor, I'm here, they tell me what to do. So I did not understand the questions to ask then, or the alarms to ring. But when I knew something was wrong when we were in the C-section room, and I heard cursing and screaming and craziness and people rushing in, and I think he didn't cry, came out. I didn't see him, my husband did. But he was APGAR 1. They had to retrieve him. He'd gotten stuck and lost oxygen apparently, but we did not know that until later. We knew he'd gotten stuck. We knew that the birth was really traumatic, but we didn't know the extent. He was APGAR 1. If you don't know what APGARs are, they go from 1 to, is it 10? He had the smallest little cough, and that was the only thing that gave him a 1. Otherwise, he wasn't breathing. He had to be intubated, rushed to the NICU, and we spent about a week there, and they just really couldn't give us an answer as to what had happened. They just kept saying, sometimes it's just a hard start, he's going to be fine. And so we were discharged after about a week, and mind you, this is my first child, so I had no idea what to expect. But I certainly didn't expect that, and the guilt, the mom guilt of what did I do wrong to, what's wrong with my baby? And, finally he started, he was able to do things like he held eye contact, he breastfed, so we thought he was a typical baby, and, in our view, but he was rather large, yeah, which I took as a mom badge of honor. He had a whole bunch of those chunky, lovey fat rolls. And so when he wasn't quite, sitting and holding his head fully up, and he wasn't crawling, like those things you start hitting around 6, 7, 8, 9 months, we kept asking our pediatrician, like, is there anything wrong? They were like, no, he's just a big boy. And boys are later, and he's big, and you're doing a great job. He's fine. And about 11 months, I just started being like, I had a friend whose baby was 3 weeks behind mine, and we were FaceTiming together down in Louisiana. And, her little girl was cruising all around the table, and my son was not. And it just, there was something about it. I was just like, that mama into it. You're like, something is not right. So my pediatrician told me I was being basically dramatic, and I was over worrying. There was nothing wrong, but she would make the referral to early intervention anyway. This was about the 11-month mark. And I got stuck at the office, and my parents were there to meet the early interventionist that came out to do the initial assessment. And I walked in about 1 minute late, and she'd already kind of gotten there, and she just looked at me and said, can I ask you a question? I said, what? She said, did he lose oxygen? And I was like, yes, he was at APGAR 1. And she said, I'm not a doctor, but I think your child has cerebral palsy. And that was the first time I'd ever thought that, heard that. And so we quickly and they qualified him, and he qualified right then for early intervention services, and they got therapies going. But then we still had to wait for the medical diagnosis, which we were able to get into Le Bonheur in Memphis, and met with a neurologist. They did an MRI, and he came in and said the same thing. Your child has had an hypoxic brain injury, loss of oxygen, lined up with his birth. And I'm actually glad he's not in here for this. I always get emotional talking about it. But, it was just, it was shocking, the grief and the just, wow, how did I not know this for a year?
Well, how did the experts not know this for a year? I mean, the checkpoints that you all made it past.
Yes.
Without the hospital team or the NICU or the pediatricians or the other people who met your son. I mean, that is chilling.
It was rough. We had the same thoughts, but, so see, people always ask, I'm like, hindsight's 2020, right? Like, now I could have seen it. Had he been my second child, I would have seen it more probably. I just didn't have anything to compare to. And you rely on the experts. Like, that's what I tell people. When a doctor tells me to take this medication, I'm going to take this medication. When the doctor says I need this surgery, you get that surgery. And so, I'm relying on these people that tell me he's fine. And he was obviously very, he was not fine. But so that started our journey. And at the time, I was an employment lawyer. I did employment litigation. I represented individuals, plaintiff side, so I did a lot of ADA work. So it wasn't too far of a leap for me to switch over to kiddos, and I didn't mean to. It's just going through it personally. My husband's looking at me like, you're the lawyer. What are we signing? You start signing all those things to get early intervention and sign up for services. And, at first I was just like every other parent, like, thank you. What can you give me? And thank you. After you get through a little bit of grief, you realize, and we'll talk about this more, but you realize that it's not what can you give me, it's what does your child need and how can I get that for my kid. But that's how we found out, and that's when our journey really started and my life really changed. And I would say absolutely for the better. Not that I would ever wish this on my son or anyone else, but he has totally changed my life, my career. Helping him has helped me help so many other people. I mean, it's the only silver lining I kind of see in all of this.
I mean, it's so many things wrapped into one. Right? I mean, you mentioned it feels like the news was devastating initially, understandably. I'm sure it felt like some kind of relief to know what was going on.
It did. It did feel like, at least I'm not crazy. Something is, quote, wrong here, which I don't like that word, or not normal. Something's not typical. So it felt like, okay, at least we have a diagnosis, and now I can label that and get him help that he needs. But at the same time, I mean, and I tell this to every parent, you're not wrong to be sad. You're not wrong to grieve the life that you thought your child would have, and particularly when they get diagnosed so young, you don't know. And every doctor just kept saying, we don't have a crystal ball. We can't tell you. So your brain goes to the worst. I pictured my child unable to speak to me, unable to walk, unable to do all these things. And that's just, you go really dark really fast, and there's a whole period of grief, and that's okay. And I tell people that. I tell my clients that all the time. And then, they kick themselves because they didn't get diagnosed sooner. They didn't know. And I'm like, you're not the doctor, right? Like, you're just mama bear, and you're doing your best. And I can say that now confidently on the other side of it, but I can tell you, and I was in the thick of it those first year or two, I refer to it kind of as the dark ages, because I don't know. You just put one foot in front of the other and you survive and you learn. But I learned so much, and it was just kind of like drinking water out of a fire hose, trying to wrap my brain around a diagnosis. I had no idea what it meant, and a life that was going to be totally different. Mm-hmm. So there's just a lot. It's a lot to unpack there. And so my heart goes to every parent who's getting that news for the first time. And I just want to tell you, it's going to be okay. Your life is going to be different. Your child's life is going to be different, but different isn't always bad, right? And you can learn so much, and it can be so much better, but it's just really hard getting through those first stages of grief.
I think that's so important for parents to hear. So anything else you want to mention about your son or his presentation before we move along?
Sure. His presentation, meaning how it affects him.
Yes.
So he, like I told you earlier, he's that rare type of the athoid or dyskinetic. Our doctors refer to it as dystonia, meaning he's tight and he's loose, and he's more impacted on the right side. Which now looking back, we saw that every picture of him under 2, his head is drooping and hanging to the right. He couldn't quite hold his neck up straight. His right hand, he would always keep turned back and around. and in a ball. He acted like it didn't exist. He would reach over on his right side with his left hand to go grab something and bring it back. I mean, he just acted like he didn't have that whole right limb. And his right foot, turns out, it still does. We combat this all the time. Now he's 13, and I'm like, heel strike, foot forward. And he can do it when he thinks about it, but when he doesn't think about it, it's just naturally gonna flow out. And you've got to protect that so you don't do hip damage. I mean, it's just all these, it's a domino effect of different things. But so that's him in a nutshell. It's the more right side impacted, but it's also, he does not have a cognitive impairment that we're aware of. His is more the tone, and he's this mixed bag. And so the neck is looser, the core is looser, the hands don't relax well enough to type fluidly. So he's a plucker. We keep trying to do different stuff with him. I'll talk about that later, about the different types of low tech and high tech we use. But it's just, everything has just I call it just a touch of cerebral palsy, where you would think that, okay, if he can't type very well in this techie world, then he could do speech to text. But his speech is affected too, because the tongue is a muscle. The mouth requires muscle control, and he's got fluency and articulation. I think you're going to hear from him in a little bit, and you'll be able to tell a little bit. But he's overcome so much, and he does so well. But it's everything. Everything has a touch of cerebral palsy that makes, okay, well, if you can't do plan A, you could do plan B. But for him, it's just, we're trying to always be creative in how to accommodate his varying, tone issues and speech problems. But he's funny every time he grows. So we're like, now we've got to change again, because it with growth, your muscle tone changes, and so you're fighting the tightness in the ankles with the looseness in the core. So he's just he's a mixed bag. He's a moving target.
It's always changing.
Always changing.
So talk about who's part of his healthcare team.
Oh, he's got quite the team. And over the years, that's changed too. I will say it has gotten much more reduced and much more manageable as he's gotten older, because some of the issues he's grown out of, or they've been fixed with procedures.
That's amazing.
Yeah, it's great. But for the longest, I mean, I joke that I lived on I-40, not just being a litigator in Tennessee, but I-40 is our interstate that runs across the state, by the way. But because Vanderbilt, which was where we got most of our care, was, and we live in Jackson, which is about 2 hours away. So we had lots of Vanderbilt appointments those early years, the first, I would say 6 or 7 years. It was a lot. And he had quite the team. But what I loved about them was they did coordinate. He had a pediatric neuro specialist there. And she's been with us since he was 12 months old. She was previously a physical therapist and then went back and got her MD. And she focuses in neuro. And so she has like a specialized cerebral palsy clinic and has a team. And really, I would say she is our quarterback if we had to have a quarterback besides me. You kind of look to, but I tell parents this too, one doctor is not going to give you all the answers. So it requires a team of care, and it requires just continually looking and researching what else is out there. And a lot of times we're the ones telling our doctors about some new program that we found. I think
the coordination piece often gets overlooked.
It does.
The providers and experts need to be communicating with each other. Mm-hmm. It's really important for everyone to know what's happening in other therapy sessions. And if they don't, it's going to be less effective.
Right. Absolutely. A lot of times it's in isolation. And here's an example, his pulmonologist and his ENT at Vanderbilt were great. I don't know if it has anything to do with CP, probably not. But he ended up having 3 sets of ear tubes. He had a bunch of adenoid issues, tonsil issues. So by the time he was 5, he'd had his adenoids taken out, his tonsils taken out, 3 sets of ear tubes, and he was still just always so sick. And a lot of that has to do with the cerebral palsy too. There's so many effects of cerebral palsy people don't talk about, but one of them is they can't cough, like because of his low tone in his trunk and just general weakness, he can't cough and be as productive as you or I. So where we would cough and get things out of our lungs, a lot of times it would settle. So when I tell you we had continuous pneumonia, I mean continuous pneumonia when he was little. And so we had to do all these things, all these treatments. We were chest compressing all the time with like a thing to break it up, kind of like you would with, what's that called? cystic fibrosis, kind of like that treatment to keep it broken up. So he just battled so much of this, but it took the pulmonologist and the ENT also to collaborate and realize he had because of the muscle, I mean, when I tell you it affects everything in your body, he had a delayed swallow. So as you or I would feel the food go back and then we would open and swallow, he was aspirating and had a delayed swallow because it was going back and he wasn't swallowing in time. So they did what was called a laryngeal injection, and that took our coordinated team, and I will be forever grateful for that, because that really, really was a game changer for him in terms of ending the cycles of pneumonia and aspiration.
Wow.
Was that they went in and did a injection where they plumped that up. I don't know how to describe it, but the back of your throat. That way it would trigger the swallow quicker so that he wouldn't aspirate. And so we did a couple of those, and I mean, that was a game changer for him. That and feeding therapy to quit aspirating. But those are just things that people don't talk about. Is it's not just putting braces on the legs. It's a lot of it was just swallowing right and coughing and things like that.
Do you want to clarify what difference that made for him?
Oh yeah, absolutely. He quit. He didn't quit completely, but the endless rounds of constant respiratory issues and pneumonia really, really subsided after that. That, and in addition to the feeding therapy too, to help with the swallow and to not aspirate. But that was a game changer because he was just so sick. And when he was so sick, he was missing so much school and I was missing so much work. And, it's just this vicious cycle. And you're just like, this poor baby cannot seem to catch a break. And I would just dread going into particularly the winter months and being like, please don't be around us if you have a cold. It really hits him harder than anybody else in the room. But he's fortunately, we are so much better on the other side of that. I was very scared with COVID, thinking, oh, here we go again. Like he's going to be the one that gets hit worse. I mean, terrified. That was like a whole re-triggering event as I was going back to, well, if you had pneumonia so bad at 5, like what's this COVID situation going to do? But fortunately, he's been okay through that as well. Amazing.
Okay, so we've got the neuro, the pulmonologist, the ENT, any other important?
Oh, regular pediatrician, of course. And then speech therapist, occupational therapist, physical therapist. And then he does intensive therapies every summer as well, which I can talk about in a little bit when we talk about treatments.
Okay. After your son was diagnosed and he started receiving treatments, yes.
One thing I forgot, psychologist is very important as well. You're going to need that for school. Just because it's a physical disability doesn't mean that there aren't mental components. He has a lot of anxiety related to his condition. I mean, just the things that we take for granted on doing, like I'm just going to write this down or I'm just going to open this door. I mean, it just requires the brain pathways just aren't wired quite the same because of that disorganization where he lost the oxygen. So it's a lot harder on him. And he has a lot of angst about certain things and feeling different. He wants to be as typical as possible. And so, I have to be there on time. I have to get there early so I can get this done and get this, and just it takes him longer to do things. So there's just a lot of, and the people don't talk about that, but there's a lot of anxiety that's comorbid with having any type of disability to begin with, but particularly one that affects how you communicate with the world and how you appear to the world. And so he just has so much angst about that. He's doing so well, but I think that's important, is the mental health component too, and just to keep an eye on that so that, your kids get the help they need if they need it. And also to our psychologist.
Can we just give him can we give him some credit right now? Can we pause and give him some credit?
Yeah.
I mean, what he's had to battle.
Absolutely.
And the strength he's shown to deal with his stuff and get to where he is. I mean, that's a strong kid.
He's an incredible kid. I don't know how I'm so lucky to be his mom, but I am. He's an incredible kid. And his therapist will tell you that he's come so far because of his resilience and his want. And that's important. And so we try to keep that focused and keep it positive. I don't want therapy to be a negative thing. It's always been a fun thing. We try to make sure that he's engaged. He likes his therapist. When we go do intensive things or medical trips, we put fun with it. Just trying to keep it positive because you want him to be positive, and I think that that's helped so much in his outcome. But that's also why I think that just focusing on that mental health piece too, and checking in and having that psychological evaluation every few years has helped us know where his strengths and weaknesses are. And it helps bolster those accommodations that I asked the school for, because it's coming from a psych as well.
Sure. Absolutely. Makes a lot of sense. So what treatments or therapies have been most successful for him?
So we've done anything and everything we can do. For the first few years, I wasn't scrolling social media. I was up reading every article I could find on cerebral palsy, trying to educate myself, and every trial and everything, seeing if he qualified. And I will tell you, the one big regret we have in terms of treatment is that we did not keep his cord blood when he was born. We didn't know. It was supposed to be a typical birth. Rewind 13 years ago, our doctor was like, unless you have a history of cancer or leukemia, you probably don't need this. I tell every parent now, disability or not disability, you keep your baby's cord blood and cord tissue, because it's a little bit pricey on the forefront, but then you've got it the rest of their lives. If they're ever in a car accident down the road and have a traumatic brain injury, if they ever need any type of, there's so many things for it. So I'm a big proponent of that, because we did not save that. And had we saved that and banked that, he would have already received it immediately, pretty early on, because they were doing Duke. Dr. Kurtzberger at Duke was doing trials with your own cord blood, but we didn't have our own cord blood. So I literally stalked this poor woman in her email for about 5 years, being like, if you open to siblings, at that time, we didn't even have another child, but I was like, I'll get pregnant tomorrow. Well, we wanted another one anyway, but I was like, if you ever open this up to siblings, we are absolutely banking, please let us know. And so we just stayed in touch with them, and they eventually did open to siblings. And in December of 2018, his brother was 5 at the time, he was 7. He got 600 million cord blood stem cells from his brother's cord blood, and that did not cure his cerebral palsy by any means. So you'll see him in a second, but it dramatically helped that core stabilization. He quit falling as much. When I tell you, it was like overnight. After a couple months, we were just like, when was the last time we saw him really wipe out? And he'll tell you, he's a professional faller. Like his physical therapies are about how to fall right so you don't hurt yourself worse, right? And we were like, he's not been falling. It was incredible. His handwriting went from illegible to legible. It's still not great, but I'm his mother and I have terrible handwriting and I don't have CP. So I think some of that he got honest, but it really was a game changer in terms of helping some of that fine motor and core strength. So I think that's one of the most successful things in treatments that we've done for him, and by far the most impactful.
That's pretty high tech.
It's amazing. It's amazing. Like chills. I still remember where we were when we got the call that his brother was a match, because there's only a 50% chance that they would be close enough that it would work. You hear about a lot of families going, out of country and stuff to get them from donors and things like that. But we were fortunate enough to get into Duke. So that's what I tell parents all the time is take disability out of it. But for every kid, bank their cord blood and tissue, because you never know what you could use it for down the road. And fortunately, we were able to use his brother's. And so I've got these pictures of his brother being there by his bedside. And it was just an infusion. Like, they hang it up, but he was Vanna Whiting the blood, the drip bag, like, you're getting my blood.
That's a special brotherly bond. It
was really sweet. And his little brother loves mac and cheese, and Gray would never touch it. Gray's such a foodie. He's the most expensive child you'll ever take to dinner, by the way. He's like, I'd like 2 rounds of escargot, the salmon tartare, and the wedge salad followed by scallops and the filet, thanks. He's like $100 dinner, and he doesn't even drink, obviously. But he never liked just kid things like mac and cheese, and his little brother loves mac and cheese. After he got this cord blood, I'm not kidding, he was like, I want mac and cheese. We were like, this is so weird.
He took on his brother's taste.
We were like, now if you start eating popcorn, we'll know that this is really legit. He does not eat popcorn, but that was, I would say, the most beneficial treatment. Other treatments we've tried, we've done the Botox injections. That's a big one in the world of treating with cerebral palsy.
What does it do?
So we've taken it both orally and injections. Orally, we took it to, but again, it's hard because you have to get the right dosage, because you can't, quote, flop him out too much, but it loosens those tighter muscles. So it was helping him get better range in his heels. His heels are very tight. So we stay in brace a lot to keep that flexion and that range stretched out. So the Botox helped I'm sorry, Botox, the baclofen orally, which is similar to Botox. It's the oral. So we were doing baclofen pills, and that also helped with some tightness in his hips. It was just helping reduce the tighter areas, but getting that right dosage to not flop out the areas that are already too loose was tricky. And we did that for a few years. And then we tried the targeted Botox injections. We flew to Atlanta and did those a couple years ago. They were so painful, a huge needle. It was bad, but they're very helpful for a lot of kids. We just didn't see the gain from it, and I'm not going to put my kid through something that's painful. And he's able at that point, he was 11, to tell me this helped or didn't help. You know, when they're younger, it's so hard because you're like, is this helping or not helping? And they can't tell you. It's so great now that he can tell me, hey, I like how this medicine makes me feel. Hey, I like how this therapy helps me get stronger. Hey, the feedback is so great. So hang in there, mamas, until they get a little older. It's much better when they can tell you. Another thing we did that was really, really helpful is we went through a lot of cereal casting. A lot of cereal, not cereal that you eat, cereal, like meaning sequential casting. And so what they would do was, remember I told you earlier that right hand kind of acted like it didn't exist.
Yep.
And so to make him use it, it's kind of like akin to when you've got a lazy eye, they'll patch the good eye so that your lazy eye gets better. Mm-hmm. Same thing with casting. So they cast his right arm and just made it where he couldn't use it. I mean, not right. His left. I'm sorry. Yes, his left arm, so that he couldn't use that good hand, or his better hand, I should say. And it made him start using that right one. But it wasn't. The second it went off, he went back to pretending it didn't exist. So we had to put it back on. So we did a series of those. It would go on for a few weeks, and then it would come off. You know, because you don't want to keep it on there permanently. You got to take it off. But that was, as a mama, that was one of the harder things to watch, because he was only about 18 months old when we started doing that. And at 18 months old, I can't explain to him like I could right now, hey, this is to help you and it's not going to hurt you. It was scary. And then they had to like cut it off. I mean, so I was just, that was all my feels, just cried every time we did it. But knowing that I wasn't hurting him, he just didn't understand. But it was so helpful because he started to use that right hand. We cast it again to get range in his legs.
Just with the hands, how long was that period of casting until he was able to use his right hand effectively?
It was on and off for a period of 6 to 8 months or so, I believe. It's been a hot minute since then. He was between 1.5 years and 2.5, 3. So it was, and his occupational therapist did it, and that was the good part. It was, you know, in his treatments, in his regular therapy center, and it was somebody he trusted, but it was still really scary for a little tyke. We did casting again with Vanderbilt with their PTs, trying to stretch. His feet got really tight. And when you lose that range, it becomes very difficult to have any type of somewhat even typical gait pattern. And so just picture like fighting your tone. So you're trying to take the foot and like picture me picking up, if your hand is your foot, I'm picking up behind your fingers and pulling you backwards towards your wrist, right? So that's what we were trying to get in his feet, is get that range, right? Mm-hmm. So we would cast and they would notch it up and then cast him and hold it there. So he was on both legs. So from toes to knees, he was casted. And this was when he was in, let's say like first grade or so. He could actually still walk on them. Really? I was just going to ask about that. So he would use his posterior walker, and just like he would with just his braces on, and he was able, we would sock over him because we were doing some of this in the winter and his poor little feet were cold. So we would put these big, huge tube socks over him, and, you know, he was resilient because he went to school like that. He went everywhere like that. That was a rough time, but that's where we tried to pair that with fun trips. You know, we would like, we're going to go to Vanderbilt, so we're going to take you to the Gaylord and go, you know, eat a fun dinner and play around. But then, by the way, you have to put the cast back on. He'd be like, no. But he took it in stride and knew at that point he was in first grade, and we could explain, we're just trying to help you long range, long term. But we've done things like that are uncomfortable, but I knew that I would tell myself anyway that I wasn't hurting him, I was helping him, but it was still really difficult to watch your kid go through that.
Sure.
You just want your kid to be able to run and play and be a typical first grader, not not be casted on and off for months. But he took that in stride. We've done a lot of electronic stimulus. This was where social media was great. I met a lady in Florida, and her kid had CP, and she came up to me. And this is where moms are just great. She came up to me. We were sitting outside of a restaurant, and she walked up and said, "Hey, Mama, I see your little boy over there." And he had his posterior walker. He was about 3 at the time. She was like, "I just want to let you know that's my baby over here." And he was about 10. She was like, "It does get better, and just hang in there, Mama." And we ended up talking for a while and shared Facebook stuff.
That other boy had CP
Yeah,
too?
and she could tell that mine did, and that I was a young mama with it. And she just came over just to give words of encouragement and tell me that,
Nice.
It does get better. And, life, they will still have a full life. And, just words of encouragement. And
now you're doing the same for others.
Yeah. Pay it forward. But we kept in contact on Facebook, and I saw that she posted about this robotic rehabilitation program in Atlanta. And, we live in Jackson, Tennessee, but I'll fly wherever for treatment for my kiddo. And we went out there, and we did that for 7 summers straight. And that was so wonderful. We would go for 2-week intensives, and they use a lot of electronic stimulus. When you lose oxygen, which causes cerebral palsy, those pathways that are, I'm just giving an example that tells you, pick up this bottle of water with your hand. Sometimes that's harder for other kids because that pathway isn't there. So it's retraining those movements. So they put the stimulus on legs, and then they would make the movement, and it would fire, which helps retrain and fire the brain that this is when I move my leg, this is when I move my hand. This is the gains he made in that program. I sent it back to my family. I took him down by myself the first time we went, and I sent them a video of him, I distinctly remember this, running down the hall of the Marriott in Atlanta in his socks, but he was running. And no, it wasn't a typical run, but he was going forward, not side to side, and was so happy. And I sent it to my family. I was like, "Who is that?" That's great. It was so helpful. They had an anti-gravity machine that they put him in called an Alter G, and it gives them immediate feedback because they watch their feet on a video screen, but they're able to lift like 70% of their weight off so that they actually feel a typical gait pattern for the first time. It's things like that you can't just do with typical therapies. So it was really, really, really beneficial. We've done some other ones like Napa Center recently too.
I'm sure people who are hearing this are wondering about the costs and expenses for treatment and the devices and supports that you were able to secure. So let's talk a little bit about that. And has there been any financial support made available to your family to assist with these things?
No, there is financial support for families. We don't qualify. Tennessee, every state's different, so I would say check with your states. But my child doesn't have a cognitive impact, so a lot of times that's a disqualifier in terms of state funding. Typically, the cognitive impairments get more support, or extreme physical. He can go to typical school. He can talk. He can walk. He's just not. He doesn't qualify for that severe of need for kind of grant funding or state funding. But we do have a grant. I need to look into it. I've got a lot of families that have done this.
Is that shocking to you, by the way, that the extent of needs that you've described, he doesn't qualify for these?
Yeah, that and our income doesn't qualify because we work even if we didn't. It's such a low threshold to hit to qualify financially. But so no, fortunately, very fortunately, we have good insurance coverage that covers chronic conditions. If I had to pick between getting him the help he needs and the therapies he needs and eating beans, I would eat beans, of course. But we fortunately have, we spend a lot in medical. We do. But that's why I work a lot too. But I mean, you just do what you have to do for your kid. But no, we don't get any state assistance with any of that. Now, I would say to look at, there's a lot of states, and it's becoming a thing. Here in Tennessee, we've got it, but I don't know about, other states if I would look, but it's becoming prevalent across the country, is if you have a kid in that kind of gap area, right, like where they're not severe enough that they need, that they qualify for benefits, but they're also, pretty high functioning, but do need some therapeutic needs. We have what's called the individual education account, and that's where you can go to your school system and say, I don't want the IEP. I want my state and local funding. And so, for instance, like Tennessee, it's about $8,000. that you would get, and you can apply that towards your therapies, towards anything that qualifies to support that disability, or tuition at some schools that qualify. But you're forfeiting your public school IDEA rights if you do that.
Okay, so definitely need to check with your specific
it's
state on
specific.
That.
Mm-hmm.
I know you're local to Tennessee, and I'm sure parents can learn from your experience dealing with your local school district. Tell our listeners a bit about your experiences, the obstacles, the challenges, the pitfalls.
Well, I deal with them professionally and personally. Personally, they've been really wonderful to my kid, but that's because I haven't really asked much from them. He was enrolled through the school system from ages 3 to 5, but once he hit kindergarten, he's at the private school that's near our home and where I went to school. And so once we pulled him out of the public school system, obviously they're not responsible for his therapies at that point anymore, except for private school kids can get, he has an IEP for speech. And so they do provide speech therapy to him, and they come to the private school to do it once a week, which is fantastic. And she's a wonderful therapist. So I would just say, depending on which route you go, even if you've got your kid in private school, you still have a right to some public school services. And so make sure that you're utilizing those, because that helps offset the cost of our private speech that we have to do too. But professionally, I mean, I battle them all the time getting supports, because not all kids are fortunate enough to, as advanced as he is with his condition. If you look at it on paper, it would probably appear a lot worse than it looks in real life for him. And that's a testament to him. But a lot of kids don't have that opportunity to be able to be more, so that you have to be in the public school system. And when you have to be in the public school system, that's fun, it's great, it's what it's there for, but make sure that you really utilize all the services and don't accept the we don't do that here, or we can't do that, we've never done that before. I love being in IEP meetings and being like, this is the most, we've never done this for anybody. I'm like, well, great, that's a good thing, because it's individualized and it needs to be what the child needs to access their education. So but professionally, I fight them quite a bit.
Yeah, and I think sometimes where parents get themselves into a little bit of trouble is trusting the school district year after year after year when they're being given information that may not be accurate. And so I think your point about challenging what's being said to you and emphasizing your child's individualized needs and what your child needs to function, that's really, really important. And if the people in the room aren't on your side in that way, then it's time to find outside experts who will be.
100%. I would tell any parent, it's really hard, particularly when it's your own kid. First of all, your emotions, you're in your feels. It's really hard. And a lot of times the parent says that they just feel so defeated. It's them versus 10 educators in the room, and they're like, and all they do is focus on the negative about your kid and their behavior or whatever the case may be. Or how they're doing all they can do to help Johnny. This is all we can give. This is all we've got. So I think sometimes it's helpful, because you're so personally attached and it's your kid and you're dealing with the emotions, to have an outsider in the room. It's worth the money to get an advocate, or at least do a consult with one of us, with a lawyer. There's so many times I look at a kid's IEP and I'm like, actually, can I see the 2 years before this too? And it's wham, bam, thank you, ma'am. We've just changed the date on this. The goals have remained the same. The services are the same. Everything's the same. And you can just look at that and know Johnny's not getting what Johnny needs. I mean, there's no way that any kid stays the same year after year after year. And so it's helpful, I think, to have an outsider's perspective, and particularly an expert in the area of special education, because you just don't know what you just don't know. And, parents beat themselves up over that. I didn't know that we could have a one-on-one and he could have been included in gen ed instead of, 7 hours a day in a self-contained classroom. I know you didn't, because you trusted the school, just like we trust doctors to tell us what medicine to take. You trust educators to tell you how they can best educate your child. And you're not a teacher. And they like to throw that at parents all the time. Well, I've been a teacher for 29 years and this is all we can do. And, parents feel that and you feel attacked. And so I think I tell people all the time. And there's a lot of advocates that are free or reduced too. And there's a lot of parent side organizations that you can access. I just think that if you've got any child that's got any disability, whether they need an IEP or not, even if it's just a 504, a lot of times people don't realize they can get therapy through a 504. They can get so much more, and the school's not going to tell you that, because telling you what more you can get, what's that equates to dollars, right? And ultimately it's about the dollars.
A sad but very true reality.
Yeah. So I just really think that getting someone to help assist you with that process is the best money you'll spend for your kid.
Jessica, looking back now, is there anything you would change with the treatment plan or therapies Gray has received?
I've always said, and I'm not trying to paint myself as Mother Teresa or anything like that. I'm just doing what I can to get by. But I always just wanted to look my kid in the eye and say, I did everything I knew to do for you. You know, when he's 18 and realizes that, I think he's just now coming to grips with the fact that this is lifelong. I think he's always kind of thought he does these therapies to outgrow it. And because he used to say things like when he's going to be a wide receiver for LSU. And, you know, it's just really hard to be like, maybe that's not in the cards. But you just never want to you don't want to place limits on your kid. But I also wanted to make sure that he was given every opportunity. And I think that we've done that within the realm of everything we know. There's always new stuff. Every 6 months or so, I still do Googles and check out any cerebral palsy trials to make sure we're not missing anything that's on the forefront. There's one going up in California right now we're on the wait list for, with a new device that's supposed to be really helpful that goes on the outside. I mean, we're just always trying to find and make sure that we've given him access to everything. I mean, that speaks a lot to our privilege too, which I hate because not everybody has the means and the ability. And that's why I work for myself is he gets into a trial, I get up and go, you know, I have laptop, can travel. But not everybody has that flexibility. And I totally understand that. So I just tell parents, do the best that you can do for your kid within, you know, your limits, your means. But I think we've done that by him. I hope that we have. The only thing I would have done differently is trusted my gut sooner and taken him to get third, fourth opinions in those first years or those first months. Not that I think that had a huge impact, but the earlier the intervention you can get, the better. I mean, they can start that at 3 months old and, you know, so we missed that little block, trusting people telling me that it was in my head and I was being paranoid. But that's the only thing I think that I really regret is that, and not feeling my gut on that, you know.
You've done great. Seriously. I'm in awe of you.
Oh, thanks.
Has Gray encountered negative experiences as a result of the CP with his peers?
Oh, I mean, of course. But I will say that kids are resilient and they are kind to their core, particularly at an early age. And that was one of the things that was important to us. And that factored into why we put him in private school is it's smaller and he would have the same peer group from 2 years old through 12th grade, whereas in the public school system, you know, they would bounce from different school, you know, as you matriculate through elementary and then to middle and to, you know, they're often different schools and sometimes that's even like a couple of years and then you go to a different one and you get new peers. And I just wanted him to have a solid core of friends that have known him from the beginning. And so it's really nice. Most of those boys and girls that he's been in class with since he was 2, I mean, he's just great at them, right? Like the braces, kids don't see that when they're little. Now the ones that come in are like, oh, what's up with that? But, you know, then I was always like, that's just great, SCP. I mean, for the most part, I will say his experience has been very, very positive. I mean, there's always a few situations that are tough or somebody says something ugly or particularly in different environments. For a while there with his stutter, he would be afraid and he'd be like, can you tell, we'd meet somebody new and he's like, well, can you tell Johnny that I have CP so he understands? Like he wanted me to be the buffer so that, you know, because it was somebody new that he hadn't met. So there's that kind of thing. But for the most part, he's really had a very positive experience and he will tell you, everybody needs to see me for who I am and not for my disability. Like he's just so wise and mature beyond his age. Yeah. But you know, he's had a pretty great experience so far, and I credit his friends with that.
Nice. I'm glad to hear that. So Jessica, parents often set milestones for their children and their development, and those often differ with children with special needs. What have been some of your proudest moments as a parent of a child with CP?
Oh, gosh. I mean, it's really full circle from getting told, looked me in the eye and said, there's no cure for this, but therapies can help, but he may never walk or talk. I mean, you picture your child basically having no quality of life, you know, under those circumstances of very, very bleak. To then fast forward 2 years later, I mean, we just threw the bag at it. The whole kitchen sink. We gave him every intervention we could find that we could do. Music therapies, water therapies, physical therapies, horseback riding therapies, occupational therapies, this kind, and just so much. So when he first took his first steps, they actually called me. There was the ones I saw in person. He walked at the lake, and I just lost it. I was pregnant with his little brother then, and just remembering like, oh my gosh, he's going to be able to walk in to meet his brother. Like, oh my gosh.
That must have been amazing.
It was amazing. We actually named his brother Jack because his speech was so impacted. We tried out like 5 different of our top 5 names, and Jack was the only one that he could really say easily, but he called him Yak. So he was Yak for a while. But yeah, he got to ultimately pick because it was what he could say. But when they called me at work and they were crying at the daycare, he went to the therapeutic daycare where his therapies, we got in. It was a wonderful resource through the West Tennessee Healthcare there. And they mix typical kids with disabilities, but once he got his diagnosis, he was able to get right in. And they come inside to give them the therapies in the classroom, in the natural environment. And they called us to... they started.
Hang on 1 second.
Can we go through it?
I'd rather get them stuff. Sorry, Jessica. Let's just give her a minute. You doing great? You feeling all right?
Yeah, fine.
Okay. So this question
Oh,
about...
yeah. I was saying when they...
We'll take a pause
Oh,
until
okay.
she comes back. I'm just saying, we've got the question we're on.
Mhm.
Is there anything else you want listeners to know about setting expectations for progress
Yeah.
and regression?
I don't like the plateauing, and that this is just where your kid is. They're not going to get any better. Or we stop therapies at 5th grade because how you write is how you write.
Okay.
That makes me fight and angry.
So we'll cover that, and then if there's any tips on advocating for your child or any resources, you can mention them, and then we'll bring in Gray.
Okay.
I'm so happy he's here. I feel like so often my job is talking about kids who I've never met in person, and to actually get to meet them in person is very nice.
Yeah, he was pumped. He was like, "Can I do it? Can I be on it too?" I was like, "I'll ask him if he can ask you a question." He's like, "Okay."
We're gonna vibe. His interests match mine.
He's funny. He's so funny. He's getting sassy though. This 13, man.
Yeah,
Oh.
my kids are.
And I've suddenly
younger.
become so uncool.
Oh.
I used to be cool. Now I'm so uncool.
Sounds like it's
So I do stuff just to mess with him. Like I pick him up from school. Like the last day I rolled in, I had "School's out for the summer." Like rolling. It was like got to hit the floorboard. He's like, "You're the worst." I'm like, yes.
So I get to take advantage of this while it's quiet. Let me see. Should we keep going?
Get the content in.
Okay.
I'll be right here.
Thank you so much.
Okay. Oh, I think I was telling you about. So they called. He was at daycare, and they called me at work, and they were crying. The daycare director was, and she said, "We just made an announcement over the intercom that Gray took 4 steps across the playground by himself without his walker." And I was like, "What?" So that was, that was big.
Yeah.
But yeah, I'm just immensely proud of every time he does something new. This summer he started after we got back from us last stint. We did 3 weeks at Napa Center out in Denver, and that helped a lot with the core. It's a lot of core and balance work when his core has just gotten, it's what we fight that all the time to keep him stable. And he came back and had he's normally scared to feel out of control with his body, but he got on the tube, and now the kid's an animal, and he won't quit tubing behind the boat. And I'm like, if you'd have told me you were going to do this last year, I would have never believed you. But he's just always shocking us with new stuff.
Nice. What do you want our listeners to know about setting expectations for progress and regression?
Definitely fight the regression. You will regress if you don't keep going. And unfortunately, I see that a lot with schools I kind of say they get worn out with providing the therapies at a certain age. A lot of times you'll see they're like, we don't actually do occupational therapy in middle school because how you are is how you are. Nothing gets me more on my soapbox and upset than statements like that. I firmly believe that you've got to keep fighting, particularly as they're going through puberty. Their bodies are changing, they're getting older, or they're going to unlearn some of the good skills that they've picked up in their therapy. So we do balance, and I think that's a struggle, is balancing life and therapy. I mean, I could therapy the kid to death, but he would miss school functions and being on the fishing team and things like that. And so, it is a fine line, you're balancing it, but don't accept the whole, this is where it is and this is how it's going to be, because nothing ever stays the same, and what's worse is regression. And so I don't want it to ever all be for naught. So we just keep pushing. And I think that's what I tell a lot of parents, is to just keep pushing and don't accept that we don't do therapies in middle school or high school anymore. I mean, that's ridiculous. Or you are how you are. Every kid can improve.
Yeah, that's good advice. I think we've covered a lot. Do you have any other tips for our listeners on advocating for their children?
Like I said earlier, I think that you need an objective, specialized mind in the room, at least once in a while. I mean, a lot of parents can do their, I tell my clients all the time, I can give you the tools, I can teach you all of this stuff right now, and then I'm just maintenance. Hold the line, and then they'll know that I'm on speed dial type thing, and I can come back in if I need to. But I think for a lot of parents, just having that person in their back pocket to help kind of shepherd it and guide them and help them along and let them know what they're entitled to is so worth the money or the service or the time of finding someone to help you. That, in addition to, making sure you bring the experts in the room. A lot of times we've got schools that they don't include a kid with cerebral palsy because they don't know how. They don't know how to modify. They don't know, which is crazy because it's 2024, but I call it prehistoric special education in the state of Tennessee. A lot of times we're enlightening them because this is how they've always done it. If you've got this need or you require bathrooming assistance, you've got to go to the room that has the bathroom in it, which is the room that all the kids with special needs are in, self-contained all day. That is not education. That is not appropriate education. No, your kid needs an aide and needs to be included full time. Someone to take them in and out. Just things like that is. And I think bringing that expert to the table, an inclusion expert, is always helpful. If you're battling the placement option, if you're battling a therapy option, bringing in your private SLP. If they're not giving you speech at school, explaining why he needs to have it in his natural environment. It's so helpful to have those conversations in their natural environment, or doing OT in the kindergarten classroom, but not accepting that because you're doing it privately means that's a scapegoat and that's a substitute for what the school's supposed to provide you. A lot of times we hear that too. Well, you're already giving Johnny OT. Well, right. It's an addition too. I'm a tax dollar. I deserve my services for my kid as well. Mm-hmm. So just, advocating to get those and bringing in the experts specific to whatever problem you're battling.
Okay. Finally, before we bring in Gray, and I'm very excited to bring in Gray, can you share any resources that you've found to be useful in your journey?
I mean, I can't say enough about COPA. It's the Council of Parent Attorney Advocates. Even for myself, that's how I first learned of this network of wonderful advocates and attorneys. And it's so great. And rah-rah, every year we get together, and it kind of gives me the to go battle the schools another year. It's just been a
Energy
really great
boost.
resource. Yes, it's like-minded people, and we're all there for the kids, and it's just so fun and so inspiring. I think that's been wonderful. And I tell all of my clients that too. I'm like, listen, I would love, I don't have enough time in the world to always be on everybody's speed dial and answering your questions all the time. You need to know when you need me, and you need to know some of your basic rights. So you need to go get, they do certification trainings for advocacy. I mean, I tell parents all the time, it'll be the best money you've ever spent is getting, these services and training yourselves. And a lot of them are free too. We do a lot of free webinars. But there's a whole parent side to the training of every conference. There's a whole advocacy side. You can get certified as an advocate. I mean, I tell people that, I tell all my parents that, look, I want you to need me, but not that much. I need you to be able to maintain your kids' IEP on the daily and enforce their rights on the daily and know when you're getting janked around. And you don't know that until you know that, right? And so I just think that if you've got a child with an IEP, you behoove yourself to get some basic training on their rights and knowing how to uphold those and how to, best advocate for your child, because no one is going to mama bear your baby like you, or papa bear your baby like you. But yeah, I think HOPA has just been the most brilliant and best resource.
Definitely a wonderful resource. Mm-hmm. Any other CP specific resources you'd like to mention? The
National United Cerebral Palsy is one that I looked to at the beginning. But really, I rely a whole bunch on COPA and just my own research.
And other parents
and
who have
other
been
parents.
through the same.
That's the best, is to pick the brain of another. I try to always be there for any mom, not even just CP, any mom of a kid with a disability, because it's a club it's a hard club to be in, but it is a club, and once you're in it, you have much more empathy, and you understand what people are dealing with, all the different emotions of grief and excitement when they reach new milestones, and just all that stuff. So just being there for each other.
Okay, should we bring in Gray?
Yeah, let's do it.
Okay, you want to grab him?
Sure.
I'm so happy you're here, man.
Me too.
Did that feel like a long time I was talking to your mom, or a short time?
Pretty short, but
yeah. What'd you do out there to keep busy?
Check my fantasy team. Talk to my dad.
Yeah.
Text some friends.
Nice. This your first time in New York City?
Yes, sir.
What do you think of it?
Very, interesting.
It's interesting?
Yeah.
What's interesting about it?
The people.
The people?
Yeah.
A lot of people here, right?
Uh-huh.
So many people.
So much.
Anything you've done so far? I know you've been here a few days that was really exciting or really cool.
Mm-hmm. We went to the Vanderbilt Summit one.
Yeah. Tell me about that.
Very cool, because we saw we were above 1,000 feet above the city, and we got to see the whole entire city, and drink mocktails.
Yeah, drink mocktails. What kind of mocktail did you have?
I don't know what it was called, but it was watermelon and strawberry and lemon.
That sounds delicious. And you had some really good views up there?
Yes, sir.
Nice. And how old are you now?
13.
You're 13. Wow.
Mm-hmm.
That's amazing. So I have a couple of more questions for you. Tell me a little bit about your interests and hobbies.
I like to watch sports, play back on sports. I like to go fishing and be on a fishing team.
You're on the fishing team?
Uh-huh. I like
You're a fine dining connoisseur.
Yes.
Wait, I got to go back to the fishing for a second. I just went fishing a few weeks ago. How often do you fish?
Usually, every weekend when we go up to our lake house, but not so much during the fall, in winter, because we don't get to the lake that much in the fall and winter. So.
Okay. What kind of fish you like to catch?
like any fish, brim, bass, catfish.
I caught some really cool trout a few weeks ago when I was fishing.
Been trout fishing 2 times. It was awesome.
Yeah.
Tell them where you're going this next month to fish.
I'm going to Louisiana to catch redfish and trout.
That's amazing. I hope you catch a lot.
We're going to catch a lot.
You get to keep them or you got to throw them back?
Keep them.
Nice. You going to eat them?
Yes.
I understand you like to watch some Netflix shows, right? Your mom told me.
Yeah.
What kind of shows you like to watch?
Like Outer Banks.
Outer Banks? I've been wanting to watch that show. Is that about one of the Carolinas? Yeah.
Yes.
You ever been to the Outer Banks?
No.
Me neither.
Mini. Yeah. No.
I hear it's nice.
That's nice on TV.
Maybe your mom will take you there.
Yeah,
your mom and
maybe.
your dad. And are you the assistant manager of your football team?
Yes, sir.
Tell me more about that.
Like it's really cool because like I know I can't really like play football, but I know that I can be like a part of the team, and like I really enjoy it because I get to be with my friends and like fill up waters and get footballs and that stuff.
Dude, that's amazing.
Yeah.
Can I give you a pound? I love that. That's so cool. Let me see. What else I got for you? Tell me about your favorite subjects in school, man.
I can't decide. It's between Spanish.
Wait. Spanish?
Yes.
Do you know how much I love Spanish?
Spanish is like really cool.
Spanish is my passion. One of my passions. I'm serious. I speak Spanish. It was my favorite subject in school. Oh. There's a Spanish theater that I'm on the board of in Manhattan.
Oh.
I don't know if maybe you guys want to check it out, but I'll tell you the name. This will get edited out. They have really cool performances. If you need the performance adapted in any sort of way, I could talk to the theater about potentially doing that. They have, I don't know, maybe 6 or 8 or 10 different shows happening at once, and they're amazing. And it's a really charming theater, and if that's your sort of thing, I know you mentioned you were seeing some shows while you're in town. That might be something to check out.
Oh, we'll definitely check it out.
And,
I just
they have,
texted that.
and they have subtitles for anybody who needs help with the Spanish.
Oh, that's awesome.
Yeah. So you love Spanish?
Mm-hmm.
Where does that come from? Why do you love Spanish?
I don't know. I'm just really good at it. Like,
Can you tell
Like-
me? Can you tell me something in Spanish?
¿Cómo estás usted?
Muy bien, muy bien, gracias.
De nada.
That's great, man. Nice. You watch any movies in Spanish or listen to any Spanish music or anything like that?
Mm-mm.
No.
Not yet.
Okay.
Like, this is my first year, like, taking, like, Spanish classes. I took Spanish when I was younger, but I thought, like,
It's the first time you had it as a class
Yeah.
every day.
class.
Nice.
Yeah.
Nice.
He also loves some math too.
Math and English.
Yeah. What are you up to in math?
Like algebra.
Okay. Cool.
Mm-hmm.
And what about writing? What do you like about writing?
I don't really like writing, but I like, well, I do like writing, but like, I'm like, just, don't know, it's just,
All right.
like, I don't know why I like English, because I don't like to read, like, or write, but like I like that class. I don't know why.
Okay. All right. And I'll stop grilling you in a minute. I got one final question for you. What would you like to be when you grow up, man?
What my mom does, I really want to help kids like me, get the education they need.
That's amazing. That's so cool.
I'll take it.
That's wonderful. Well, I wish you good luck. I'm so happy that you're in New York City. I'm so happy that you're in this studio. You got a great mama. You already know that, I'm sure. And she's in addition to being a great mama, she's a great lawyer. And I'm sure she can answer all your questions about being a special ed lawyer. If you ever have more questions or want another person's opinion, I'm happy to talk to you about my experience. Reach out to me anytime. Talk to your mama first, though. And listen, man, I wish you so much good luck. I hope you continue loving school and keep up the good work.
Thank you.
You got it. All right, guys, that's a wrap.
Awesome.
Thanks for listening to Curious Incident, a podcast for special needs families. Don't forget to subscribe for a new episode every month. For more resources and helpful information, check out our website and blog at dayanlawfirm.com. This podcast provides general information which is not intended to and does not constitute legal advice. You should not rely on this information for any purpose. For legal counsel, you should consult with an attorney to discuss your specific circumstances. Your listening to this podcast does not create an attorney-client relationship between you and the law offices of Adam Dayan, PLLC. No attorney-client relationship is established unless a retainer agreement has been executed between the client and the law offices of Adam Dayan. This podcast may constitute attorney advertising. Prior results do not guarantee a similar outcome. Any guests featured or resources mentioned on this podcast are for information purposes and are not endorsed by the law offices of Adam Dayan, PLLC.